Hello, everybody. We are week 2 here in Manhattan Borough President's office. I'm so proud to be your new Borough President. We've been extremely busy and we want to update you on some of what we're working on. So we're trying out this new format, a live stream update. We'll take your questions and give you the latest on what we're focused on here. We're going to talk about the Omicron wave and what it means for Manhattan. We're going to talk about the pending wave of evictions and what we need to do about it. And we're going to talk about community board applications, which are now open. And then we're going to take some of your questions. You can ask via Twitter by posting with the hashtag Manhattan Update, or you can post your questions on Facebook, and we'll get to a few of them after we give you our update. We are going to start with this Omicron wave, which has impacted so many of us, so many of you, so many of your family members have gotten sick in the past few weeks. I myself got it 3 weeks ago, and that's having had it earlier in the spring of 2020. Thank goodness I am vaccinated and boosted. And so while I was down for about 3 days, kind of with flu level symptoms, I bounced back quick. Again, these vaccines are amazing and they're protecting us now in this wave. I hope you've had yours, but make no mistake, the scale of this wave is serious. We've been averaging 40,000 cases a day. It's disrupted almost every sector of life here, from libraries to mass transit to restaurants. Certainly our schools, our hospitals, all have been impacted by shortages in the workforce because of this wave. And our hospitals have also been hit extremely hard. And I'll say more about that in a minute. There is good news. We do appear to have hit the peak of this Omicron wave, and there are signs that we're coming down off it. We're seeing this in a number of the data points. One where we see it quite clearly is in the positivity rate, which is coming up on your screen here. You can see for Manhattan, we're down significantly off our peak, and citywide as well. This is the most clear data point showing that we're coming off the worst of the Omicron wave. Also in case numbers, a little less dramatic, but you can see some good news. I'm showing here a graph that we got from a wonderful local media website, The City. We're still building our systems here, so I don't have the Manhattan comparison here as I did for positivity. We'll get you that the next time we come to you. But you can see that we had a bit of a peak on Christmas Day as we expected. We kind of dipped and hit another peak around New Year's Day. We seem to be coming off of it, still at an incredibly high level of spread, but good news that we have some momentum in the right direction. Let's look at hospitalizations, which also are at an extraordinary level, higher than we've seen at any point since the surge in the spring of 2020. And while they're still going up here, according to the citywide totals, we're getting anecdotal reports out of some of the hospitals that they feel like the pressure is starting to come off a little bit. Now, they have an enormous number of COVID patients. Their staff is exhausted and depleted, and many of them are out sick. So we have to protect our hospitals and continue to fight this wave. But there are some early signs that we may be moving in the right direction. And then we have deaths where, unfortunately, those numbers are still going up. Again, we're showing you citywide numbers. We'll get you the Manhattan numbers for our next update. We're heading into really worrisome territory. The citywide average now this morning over the last 7 days is, I believe, 72 or 73 deaths a day. What that means is that in this Omicron wave, we could potentially surpass the number of deaths that we saw in 9/11, just in the Omicron wave. So a reminder, a stark and difficult reminder of how serious the stakes are. And it's why we have to continue to push. Even as we see encouraging signs, we need to push our number one tool, which is the vaccines and boosters. We're behind. We're behind on boosters right now. Only approximately 25% of people in the city have been boosted. You need to get your booster shot. If you haven't, you need it now, and you need it for what comes in this pandemic. While we're making progress, COVID's not disappearing anytime soon. get your booster. I want to focus now on kids and the challenge of getting them vaccinated. If we can go to the next slide there. This is the one age group that is really far behind. Only 30% of kids in the 5 to 12 age range have been fully vaccinated. I know parents that you're concerned about your kids. I get it. I know many parents who themselves have been vaccinated, who have hesitated to get their kid their shots. If you have that worry, talk to a pediatrician. Talk to your child's pediatrician. They are unambiguously recommending this. You need to get your child vaccinated. And if they're over 12, boosted, because now 12 and up can get boosted, at least for the Pfizer vaccine. That's already up and running in city clinics. I put forward a plan now to continue to push back against this COVID crisis. Put it out last week, first week in this office, in the BP's office. We have a 16-point plan. I won't review all of it. We'll make sure you can see it on social media, some highlights. We want to be very clear that to be fully vaccinated, at this point, you need to be boosted. I applaud the governor, Governor Hochul, who has set that as the new standard for healthcare workers in the state. Everyone, all of you need to have a change in mindset. If you want to be fully vaccinated, you got to be boosted. We are calling on the federal government to do what it should have done a year ago, and or at least 9 months ago when the vaccines became more plentiful. You need to be vaccinated to get on an airplane. That should be the standard. Vaccinated and negative test to get on an airplane, domestic flight or international in this country. We need the federal government to act on that. We need to focus on air quality indoors as part of our fight going forward. For low-income families who live in poorly ventilated buildings, which unfortunately is a large number, the city should buy them HEPA filters to improve ventilation. In our schools, we're calling on weekly testing. That's far more than we've seen so far. And we're calling on the standard to change, that kids get tested unless their families opt out. Right now, they need to opt in, and that has led to very low testing rates. And finally, we want a web portal for you to report if you've tested positive on a home self-test. I tested positive 3 weeks ago on a home self-test. That is not reported to the city. I don't appear in the official statistics. Some of you are in the same boat. Yes, you can call 212-COVID-19 and tell them, but that can mean waiting on hold for a very long time, an hour or two, sometimes at peak. We need a better alternative. We want a web portal. This is already established in other places. Washington, D.C. has it, et cetera. Some of you are saying, Omicron's everywhere. If we're all going to be exposed, why don't we just deal with it and move on? There are compelling reasons why you want to delay being exposed. First, to protect our hospital system, which, as I mentioned, is being overrun right now. For their sake, we want to slow this down. We want to flatten this curve. Language we haven't used enough of late. Secondly, for your own benefit, there are really promising and exciting new treatments coming online for COVID. There are monoclonal antibodies that work with Omicron, which are now in short supply. But in the weeks and months ahead, these are going to be in greater supply and coming online and available to you. You want to delay getting sick because if you have a serious case, you want access to those treatments in a way that you really don't have now. So we need people to continue to be cautious. This is not a time to let your guard down, but we can take some hope in the signs that the numbers are moving in the right direction. I want to talk now about a topic which is intimately related to the public health crisis, which is the eviction crisis. We are set now in New York State to see the eviction moratorium lifted on Saturday, January 15th. I believe that would have dire consequences in a city which is in the grips of the Omicron wave and the economic shock related to that. Omicron has set back our economic recovery. It has set back levels of employment in hospitality, in restaurants, and other fields. And it's why we would face a potential avalanche of evictions if we allow the moratorium to expire on Saturday. I have joined in a statement collectively with my fellow borough presidents, Borough President Gibson from the Bronx, Borough President Richards from Queens, Borough President Reynoso from Brooklyn, in calling for this moratorium to be extended. We don't want it to expire on Saturday. But we do want to make sure that whenever that moratorium is lifted, that we are ready to fully implement New York City's landmark law requiring an attorney for every tenant. I am so proud of this legislation that I passed together with then council member, now fellow borough president, Vanessa Gibson, that makes New York City the first place in America to establish right to counsel for tenants in housing court. This is directly connected to the COVID crisis. If you look at the neighborhoods which were hit hardest by this pandemic, they track with the neighborhoods most vulnerable to the eviction avalanche we're facing. Look at these two graphs. There's a direct relationship. While we're in the midst of this pandemic, we need to do more to slow evictions, and it's why we're calling for an extension of the moratorium and full implementation of right to counsel. We don't want any cases going forward if the tenant doesn't have an attorney. If you yourself get a notice from housing court, first you want to make sure it's legit, and you'll see a case number and other signs on the document, but you want to call and ask for legal assistance. You can call 311. The operators are set up. You can tell them you have an eviction notice and you want to be connected to legal representation. You can always reach out to us. We're here to help for any tenant in Manhattan who's caught up in any kind of legal proceeding in housing court. You see the number and the email on your screen here. Don't hesitate to reach out. I want to move now to our third topic, which is an opportunity for you here in Manhattan to step up and lead, to get into the arena and speak up on the issues that are impacting your community at this critical juncture for our borough. We have opened up applications to Manhattan community boards. We want you to apply. And so I'm thrilled to ask our new Director of Community Affairs here in the Manhattan Borough President's Office, Tricia Shimamura, to join us to talk to you about how you can apply to be a member of your community board. Welcome, Tricia.
Thank you so much, Borough President, and thank you truly for being so enthusiastic and really trying to promote this really critical opportunity for local Manhattanites to get involved in their neighborhoods. So as you said, the portal is now open. You can go online to www.manhattanbp.nyc.gov and access the application. The portal will be open through March 1st. You can also find a hard copy of the application where you can mail it in or bring it to our office in your libraries or with your local council member's office and other public spaces like that. The real thing to remember with this is that if you are 16 years old and if you live, work, have a business, go to school, or have some other significant interest in a district of Manhattan, you are eligible to apply to your community board, and we want to hear from you. There's never been a greater time to have a more wide range of voices, broader diversity that really reflects the rich neighborhoods that we have throughout the entire borough. So again, if you are brand new to community boards, please visit the website. If you are a returning community board member who has just finished their 2-year term, you are also and would like to serve again, you must also reapply by March 1st.
Thank you, Tricia. Remind us again, what's the minimum age to apply?
16 years old.
That's incredible.
You want them.
High school students, we need you. We need all of you. If you are angry about the lack of affordable housing in your neighborhood, don't just complain about it. Step into the arena and act. Apply to join your community board. If you are upset about sanitation in your community, about parks maintenance in your community, don't just talk about it, apply to your community board. If you are worried about Manhattan's vulnerability to climate change and our need to harden and green our infrastructure, do something about it. Join your community board. Whether your issue is the arts or youth development or education or the criminal justice system, we need your voice. We need you to step in and be active in the hyper-local government that is on the ground, working through policy challenges in your neighborhood. No matter where you live in the borough, no matter where you work in the borough, There's a community board that needs you. No matter your background, we want your voice. So once again, apply online. We need you. We are now going to open it up for your questions. So I want to remind you, you can post a question on Twitter with the hashtag Manhattan Update, or if you're watching us on Facebook, you can put a question there. And we're just going to take a couple now, and then we're actually going to hear from, I think we have 1 or 2 members of the media as well. And so for those folks, we'll ask that you'll raise your hand using the Zoom function. That's for members of the media. For the rest of you, post on social media. So Winthrop, I don't know if you are there.
I am here.
Let's hear what people are asking.
Thank you, Borough President. We have a question coming through on Twitter. This person is asking, if people are evicted, why would that cause COVID cases to rise?
Okay, well, there's a connection in both directions between health and evictions. First of all, COVID itself has put people at risk of eviction, perhaps because of people who have severe illness and lose their employment, lose their income, and therefore might lose their home. Secondly, because the broader impact on the economy of this pandemic, even if you yourself haven't been severely ill, you may have lost your job or your small business or your livelihood. And that impact, that economic shock, continues now with Omicron. We have also seen that when people lose their home, it impacts their health. Honestly, other than a medical crisis, losing your home is the worst thing you can go for. It's not surprised that it impacts us in profound ways and can itself lead to bad health outcomes. So for all those reasons, this moment, January 15th, when we're still dealing with the brutal impacts of the Omicron wave, is not the moment to lift the eviction moratorium. So that's why we're sounding the alarm here, and why we want any of you who need help because you may have been a recipient of an eviction case, reach out for help. Call 311, reach out to our office. Legal representation is your right now. So thank you for that great question.
Great. We have another question. Someone is asking about on Twitter. They're a little confused about some of the recommendations around when to get tested. When is the appropriate time to get tested? Should we be getting tested if we feel sick, or should we rely on at-home tests at this point?
If you feel symptoms of COVID, if you feel that you've been exposed to someone who has COVID, you need to get tested. You need to get tested as soon as possible. And you can do that by a PCR test. These are the kind of tests that you're going to have to most likely go to a testing center for. They'll take a sample, they'll get it to a lab, and they'll get your results. This is a very accurate test. Unfortunately, now we have a major problem of lab capacity being backed up, and results can take 3, 4, 5, even 7 days. So there's a real practical problem. Honestly, you're almost rendering it useless if it's going to take 5 to 7 days. You have an alternative in rapid tests, which are not as accurate as PCR, but are really good at telling you when you're in the most contagious stage of sickness. And that really should be your go-to move. Again, if you feel you have symptoms, and this is what I did. I was lucky to get access to a home test. I'll talk about that challenge in a second. And when I was feeling bad, I tested positive, and then I immediately began isolating. This is what you should do. Now, we understand that home tests are too hard to come by. It's really inexcusable that this country has failed almost 2 years into this pandemic to solve the testing shortage problem. And it's inexcusable that you have to run around to pharmacies, hope you get one, and then you have to pay $24 or more for 2 tests. That's a burden for people. Now, I will say that the supply seems to be getting a little better. It seems like the pharmacy availability is better, but again, it's expensive. I strongly believe that the city, the state, the federal government need to make these tests available for free. Other countries, other states actually as well, are mailing them to you. We need that kind of option here in New York City, where anyone in the city can sign up either by texting or calling or on the web and get home tests mailed to you. That should be the standard. Or you should be able to pick them up in libraries, in community centers, in schools. In the meantime, we're doing our part. We have set up a testing site at our community, our Northern Manhattan office on 125th Street, 431 West 125th. We're offering PCR testing every day, Monday to Friday, 9 a.m. to 2 p.m. Come on by, you don't need insurance. We've also been able to secure, thanks to support from Governor Hochul, almost 10,000 test kits for Manhattan. We have been distributing them through local city council offices and through local community nonprofits. So we're going to try and get much more so that we can directly provide them to you in Manhattan. We're working on this to try and solve the testing shortage through good policy and by our own access to resources. So thank you for this question on an important issue.
Great. We have one more question for you coming through on Facebook. And they're asking, what's a typical community board meeting like?
Well, first of all, I'm really proud that I served on a community board. I served on Community Board 12, which covers Washington Heights and Inwood. I actually got to chair a committee. As a board member for 5 years, I chaired a committee of the Traffic and Transportation Committee for 2.5 years. It was an amazing experience. It can be an intense experience because the issues are really high stakes, and you're going to get direct input from people in the community who feel very strong about it. The core work is a meeting a month where you get the whole board together. That's the general meeting. 50 people, each board has 50 members. Members of the public come, and these are the most important function of the board because they pass resolutions, they hear public testimony, they presentations from community agencies, from the city itself, other state entities. There's also, during the month, there are committee meetings where board members break out into committees on health, public safety, parks, youth and education, landmarks and preservation. There are a variety of committees that meet during the month. So if you sign up for the community board, you are at least doing one general meeting a month and one, sometimes more than one, committee meeting a month. So there is a time commitment, but you are stepping up to lead. You get a vote on resolutions in your community board. You get to be a member of a committee. You may chair a committee. You may be a member of the executive board with various officers that roles you can run for. So do it. We need you. We want you, and I hope you'll apply.
Great. I think we will start taking questions from members of the media. Again, if you would like to ask the borough president a question, please raise your hand and we will call on you. First up, we have Andrew Siff. I'm allowing you to talk. Are you there, Andrew? Andrew?
I think he's on mute.
Okay, can you hear me now?
Hey, Andrew, how's
me?
it going?
All right. Hey, how are you, Mr. Borough President? My question is, the president today announced a federal deployment to Coney Island Hospital, and as well his announcement that there would be masks made available to all Americans starting next week. I wondered your reaction to that and what you make of the fact that one of New York City's 11 public hospitals is even in need of federal help at this point in the game.
I'm grateful for the federal assistance. The situation in our hospitals is dire. There are often statistics cited about capacity, unused beds. They don't reflect the reality in hospitals for a variety of reasons. Every single hospital in New York City is getting hit so hard that they are limiting non-COVID procedures, including treatment for cancer and heart stent placements. This is serious stuff. So we need federal help in the hospitals. And I'm glad we're getting it. Also good news on masks. I want to be very clear that we need more federal resources for testing, for masks, for HEPA filters, for hospitals. We need more. The city and the state can't do it alone. We need the Defense Production Act applied to ramp up production of testing. We need billions a month, right? We have 330 plus million Americans, and everyone should be testing multiple times a month. So the scale of the need is massive, and we need the federal government to do more.
Great.
Thank you, Andrew.
Next up, we have Darla Miles.
Can you hear me now?
Yes, we can.
Hey, Darla, great to hear you.
Hi. Good to hear you as well. Thank you for this briefing and congratulations, Mr.
Thank
Borough
you.
President. I want to really zoom in on, again, the resources for the upcoming eviction moratorium
Right.
that is going to be expiring, because we want to make sure we tell all of our viewers specifically what resources are available to them. So could you just explain again the attorney for each tenant, how that would work and when that would perhaps go into effect, and anything else your office might be doing?
Yes, well, of course, the applications have reopened for emergency rental assistance at the state level. The state's run out of money. They're asking more from the federal government, but people can apply at least to get into the queue. And that is very important because it also can potentially stave off your eviction. But we're going to need now at this moment to fully activate the right to counsel law that I was pleased to enact in legislation in 2017, together with my partner, who's now Borough President Vanessa Gibson. This law guarantees that you have a right to counsel if you face an eviction in housing court. It is in effect now, but we've never faced the level of evictions that may be awaiting us after this moratorium is lifted. We potentially could face tens of thousands of evictions. There are already 200,000 evictions pending in housing court right now. Many predate the pandemic. Some arose during the pandemic. If people think there's no evictions and moving in the courts right now, I'm sorry to say there are 200,000, but that number could go up much more. So if you get an eviction notice, call 311. The 311 operators are set up to connect you to your legal aid provider. There's a network of nonprofit legal aid providers around the city. And so call 311 and say you want to be connected to legal representation for an eviction case. They will be there to represent you in housing court, not just to advise you, but actually to represent you in court. This is a very big deal. It's a very important program. I want to make sure that no case goes forward now, no matter how big the avalanche of evictions, that 0 cases move if the tenant doesn't have an attorney. We could run out of attorneys. We have a finite amount of resources among legal aid providers. If that happens, don't move the case forward. That should be the standard. This is what I'm calling for. You can reach out to my office for assistance on this, your city council members and other elected officials as well. Don't go this alone. Know that you have support. New York City has a landmark program. You now have a right to counsel as a tenant facing eviction in housing court.
Thank you. Thank you very much.
Thank you, Darla.
Any other members of the media would like to ask the Borough President a question, please raise your hand. All right, I think that is it, Borough President.
Thank you so much for joining us. This has been a great discussion. As I mentioned, this was our first try. We would love your feedback on what you felt worked and what we could change going forward. Thank you for being part of this and for your questions. And we'll be back. We're going to continue to fight for you in this pandemic. We're going to fight for the COVID comeback in Manhattan to come back as a fairer, more just, more healthy, stronger borough. I know we're going to get there, and we're going to be with you every step of the way. Thanks so much, and be safe, everybody.